If you're planning on having hip replacement surgery or recently had it, you're probably wondering what is the precaution when it comes to weight bearing status and weight bearing protocols. So in this video, we're specifically going to discuss what the common weight bearing precaution is after total hip replacement surgery. So today we're going to be talking about the most common weight bearing precaution that most orthopedic surgeons recommend with this specific procedure. Now, you definitely want to go based on what your specific surgeon recommended and advised for you to use after that procedure. In general, most orthopedic surgeons recommend using a weight bearing as tolerated precaution right after the surgery. So, what does weight bearing as tolerated mean? Weight bearing as tolerated is essentially in the name. You're allowed to bear as much weight on that surgical leg as much as you can take or tolerate, right? So that's not to say you want to stand on that single leg surgical hip, because that's going to cause more inflammation, more pain, more swelling. It just means that structurally, with regards to the actual metal implant, the actual hip joint itself, that new hip joint, it's sound, it's stable, it's not going to come out when you weight bear and stand on that leg. It's really just a matter of how much symptoms you have and how much you can tolerate. So don't be worried of, okay, if I put more weight onto my surgical leg, it might pop out of the socket. That's not the case. It's very structurally sound and solid. It's really just how much discomfort are you able to tolerate and able to bear. So when walking normally, you're going to be using a walker to take some of that weight off, just to reduce some of the inflammation and some of the actual pain symptoms that you have during that first couple weeks after the procedure. Now, the day of surgery, you're literally, unless you had any surgical complications, if you had a successful and typical routine surgery, that day of the procedure, they're likely going to have you standing and doing a little bit of walking the day of. So your goal when you're first initially walking with a walker is just to get the confidence of being able to use the walker appropriately. So you can use it to offload some of the weight if the pain symptoms are too uncomfortable, or if it just feels not as steady, you're able to use that assistive device to help keep you upright, to help keep you balanced. You may walk with a limp at first, but the main thing is don't be afraid to put weight into the actual joint. It's really structurally sound, and it's just up to your tolerance, your pain tolerance of how much weight you actually want to use. But starting on the day of surgery, even the next day of surgery, you're safe to put as much weight on that leg as you can tolerate. Don't be worried about the actual structure of the hip joint itself. It's just a matter of pain tolerance. So if you've been struggling with your hip replacement recovery, I created a list of some of my favorite Amazon products that I recommend to my patients to help facilitate their recovery. Some of the things that this includes are like ice packs that are specifically designed for the hip joint after surgery. So I'll leave a link to that in the description and the comments below. I'll also leave like a QR code on screen so you just snap a picture of that and you can just follow the link to these products. I'm not sponsored by any of these brands, so all of these products were handpicked by me, and I found great feedback with my patients for all these products. They are affiliate links, so any purchases made from these links do help support the channel. One of the recommendations I give to some of my patients who have noticeably increased symptoms or discomfort when they walk and when they're weight bearing on that surgical leg while using their assistive device, I tell them that make sure in the early stages, so the first few days after the procedure, feel free to put more weight in your hands on the walker. So you're going to be using a little bit more upper body to offload the hip joint, and that's perfectly fine in the first few days, even that first week, just so that you can reduce the impact and the inflammation on the hip joint itself. And it also allows you to work on the proper gait or walking mechanics, because you're able to take some of the pressure off the hip, which allows you to work on maybe more flat foot or heel to toe walking versus just walking with a limp or walking on your tippy toe because you're too worried about increasing your symptoms, increasing your pain. So feel free in the early stages to use that walker. And as days go by or as time goes by where you're offloading that hip, the actual joint itself, the soft tissues, they're going to continue to heal, and you're going to be eventually allowed to take more and more pressure off the hands and weight bear more onto the actual hip joint itself. So if you just find yourself having more pain in that first few days with walking, with standing, definitely feel free to use more of your upper body with the walker.